morning, everyone. Good morning to our viewers. Good morning to our listeners. It is a great honor for us to be here again on another edition of Health Talk. The Mama Lume Health Talk platform is a 1-hour program that discusses a wide range of health-related issues. It brings you face-to-face with health professionals and provide you with causes, signs and symptoms, complications of diseases and illnesses that are affecting us in our respective communities. On today's edition of Health Talk, we are going to look at male reproductive health. In many societies, men generally enjoy more opportunity, privilege, and power than women. Yet these multiple advantages do not translate into better health outcomes. Men generally die 7 years before women do. This is highly surprising as women are 3 times more likely than men to see a doctor on a regular basis. Sadly, men are said to be 1.5 times more likely than women to die from heart diseases, cancer, and respiratory diseases. So why is it that men do not look as well after their health as compared to women? Has it got to do anything with masculinity, stubbornness, or shyness perhaps? So February marks Reproductive Health Month, and today the Mama Lume Health Talk platform will focus on male reproductive health. And all men are encouraged to join the growing movement toward healthy living. So today, we focus on men's health. We will look at those health conditions that are disproportionately affecting men and those that are specifically for men, such as erectile dysfunction, prostate cancer, and other cancer, and that of male infertility. By the end of the show, we will hopefully have encouraged all men out there to join the road to better health. We'll be assisted by an expert panel, Mr. Zompong O. Zoga. Mr. Zoga holds a bachelor degree in nursing, member of the Concerned Nurse Association of Liberia with 6 years practice as a staff nurse of Medical Ward JFK. 5 months of practice as an outreach supervisor equipped Liberia, just to name few. So sit back, relax, and learn from this exciting health talk coming to you just after a short break. I am Mama Lume, and this is Health Talk.
Begin at tunesliberia.com. We are Project Liberia. Mama Liberia. Must all rise. Stand together to fight Corona.
Good morning and welcome back to another edition of the Mama Lume Health Talk platform. As you listen to my introduction, February marks the month of reproductive health awareness. So this week we are focusing specifically on male reproductive health. The last time I do remember that we also talked about female reproductive health. So for today's edition of Health Talk, we are going to focus on male reproductive health. So I have with me in studio Mr. Zompong O. Zonka. Mr. Zonka have a bachelor degree in nurse profession, and he also part of the Concerned Nurses Associations in Liberia. Mr. Zonka, welcome to Health Talk.
Oh, thank you so much, Mama Lume, and the studio collaborators. I want to first of all thank you for the gesture and thank you for the beautiful studio.
So today we are talking about men's health, right? So tell about reproductive health that affects mostly the men specifically.
Oh, thank you so much. In male reproductive health, the most problems men have are infertility and sexual dysfunction, which is especially erectile dysfunction. And those are the two key things. And I will be diving into this discussion, and at least men should be able to listen to this because these have been issues that they are not known, and they are attributing infertility to only women. And we will be discussing that.
So, you talk about infertility. What is this infertility?
Infertility is the inability of a person to conceive, to make a child. And this is a problem, a global problem, and most especially in developing countries like Liberia. More men don't go to hospital to know their fertile status. And as such, it becomes an attribute to women they have that they are the one responsible. So today I am here to be able to elaborate on factors that are contributing to that, and men will learn, and if they practice it, they will be able to improve their fertile status, and they will be able to produce kids.
So what are some of these common conditions that are affecting this men's health or lead to this infertility?
There are three key factors that causes men to be infertile. And one of the factors is low sperm count, environment, and the lifestyle. And in low sperm count, there's other conditions. In low sperm count, it can also be caused by a medical condition, something they call varicocele. And this varicocele is caused by infections that causes the vessels to sweat, the vessels in the scrotum to sweat, and this vessels supply blood to the testicles. And if this vessel sweats, it definitely stops the blood flow back to the heart, and then causing a low sperm production in the testicle. And for a man to produce, he should be able to produce about 15 million cells, sperm cells per milliliter, before if those sperm can survive in the vaginal acidity. So if you produce less than 15 million, obviously you will not be able to produce. Then you will stay in a stage of infertility. And another factor is environment. And environment has to do with sometimes occupation. Like some of those people that work in hospitals and other industrial areas, they are exposed to metals. And metals has the propensity to affect sperm count, sperm production. Whereas, like in industry, more people will stay longer. And the longer you stay, it reduces the blood flow to the testicles, causing a condition we call varicocele. And also, occupationally, you look at the radiologists, people who do X-ray in hospitals. If you are exposed to the radiation, it also reduces your level of sperm count in the testicles, causing what? Infertility in men. Like for lifestyle, if you are somebody that are more social center where you taking drugs or taking alcohol, smoke, tobaccos, they also help to reduce the level of sperm production in the testicle, causing you to be infertile.
Okay. So, what are the signs and symptoms that you have to observe before you go to the hospital? What are some of the things that need to happen to a male person before you say, oh, maybe this is developing or leading to infertility? So what are the signs and symptoms you need to look for?
Okay, thank you. Infertility doesn't have a specific sign symptom, but if you are in a relationship or you are married, you should be able to produce a child within a year. In 6 months to 1 year, you should be able to produce a child. If you don't produce, you have to check your medical status. You have to go to the hospital and meet a doctor. It will be able to do some labs for you. Most especially to do your sperm count. And in doing sperm count, there are two major things the doctor will look for. Number one, they will look at the quantity of sperm production. Secondly, they will be looking at the rigidity, the speed of the sperm. Those are two things the doctor will look for. In that, if it is low, the doctor can prescribe medications available to be able to build your sperm count. That will help to make you more fertile.
Okay, just to add up on what my guest said, you will also feel the pain or swelling of the lump in the testicle area, right? Like inability to smell. You see the men, they will say that I can smell anything. Abnormal breast growth, decreased facial or body hair, or other signs of chromosomal or hormonal abnormality. Sometimes it can also derive from hormonal changes, right?
Sure,
Yeah, it lower the normal sperm count, fewer than 50 million sperm per milliliter of semen, or total sperm count or less than 39 million per ejaculation. You see some men that they have that difficulty in ejaculating, right?
Sure.
So these are some of the things I think we have when you see you observing that type of signs and symptoms within you. I think you need to see your doctor as soon as possible, because when you somebody like you are not ejaculating freely, maybe you take a very long time to ejaculate. I think you need to see your doctor. Okay, to be part of the discussions, the numbers to call are 0770-107-107, 0886-107-107. So you can call and tell us all about what you have experienced or what you want to know, or ask any questions to our guest panelists in studio. Today we are discussing male reproductive health, specifically on erectile dysfunction and that of infertility. So the phone lines are now open. You can call and send in your concern or give your comment. The numbers to call are 0770-107-107. We lost this caller. 0886-107-107. So, Mr. Zonga, I think we need to keep the ball rolling until we lost the other caller again. Something is going on here. Some men do have delay in urination. So what causes? Okay, we got a caller. Good morning, your name and where are you calling from? Oh my God. Good morning, your name and where are you calling from?
Good morning, my name is Obadiah. I'm calling from Berry Street.
Obadiah, welcome to Health Talk.
Yes, sir. Thanks for that discussion. Yeah, I really want to ask what the new men can always tackle this.
Come again.
I say I want to know why the
Premature
men
ejaculation.
can always tackle this.
All right. Thank you so much. Keep listening to Health Talk. We'll address your question, yeah? Thank you so much. So, you listening to Obadiah, he said, what is the main reason men can ejaculate sooner? That is premature ejaculation.
Yeah. Oh, you know, the ejaculations has pattern from individual, and there is a biology of every man, and every man has his speed limit or ejaculation timing. But equally so, premature ejaculation can also be caused by your sexual timing. Like for example, if you are a male mature to have sex and maybe you don't have sexual partner to have your regular sex, and it takes long before you have a partner to have sex, anxiety will make you to ejaculate prematurely. And secondly, there are men also built to have a limited time in having sex to ejaculate. And they will have the time, the pleasure to have sex for a longer time to ejaculate, but they are chromosomally, by biology, they are built to have short term in ejaculation.
Okay. Okay, Obadiah, I hope we answer your questions. So yeah, we are on some men have a delay in urination. So what causes that?
Oh, okay. Urination, there should be a pressure from the bladder to be mounted on the urethra before you can urinate. And retention in urine also, it can be caused by age. As men age, the bladder peristaltic movement, the contraction that presses on urine to come out, the compression decreases. As it decreases, the urge comes longer than the pressure is being mounted. So that's one of the reasons. And secondly, it can also be caused by infection.
Okay, we got a caller. Good morning, and where are you calling from?
Hello, my name is Emmanuel. We are James calling from Boulevard Community.
Emmanuel, welcome to Health Talk.
Yes, okay. My question will have to do with the issue of relatively death rate. When you say the timing, it depends on the man, maybe like the time you have there for, that you will cut down soon. So I want to know why is the time that you need to have that God that will make you to not cut down soon or make you to cut down the regular time you're supposed to do it. That is my question. And number two, we'll let you get the number two. The target number.
The number?
Yeah, I will let you get the target number after the show because. So let's.
So, Mr. Zonga.
All right.
Okay, you can. Yeah, you said what is the time? What is the normal time ejaculation have to occur, right?
Very good.
Okay. All right. Thank you so much.
Okay, thank you too. I'm listening.
Okay, thank you so much. You asked for the normal time for ejaculation. The normal time for ejaculation is depending on an individual. There are some individuals go 15 minutes before they ejaculate.
We got a call. Good morning, your name and where are you calling from?
Yeah, good morning. My name is Frank Cafe and I'm calling from Two Community.
Okay, Brian, welcome to Health Talk.
Okay, I really want to know the reason of which sometimes the folk can be 20 years and they can still urinate unpaid.
Come again?
I said, I really want to know the reason some folk can be 20 years and they can still urinate unpaid.
Okay. Thank you so much.
Okay.
Okay. Thank you so much for the question. The first person talked about the timing of ejaculation. Like I was saying, ejaculation timing is based on an individual. There are some men go 15 minutes and they ejaculate. Some men go 25 minutes and they ejaculate. And some men even go 5 minutes and they ejaculate. It depends on the individual. It's even likewise in the female. But if you want to have sex, if you have sex regularly, you have a partner. Because now we are talking about infertility. Infertility actually belongs to couple. So if you had a couple, you had a partner, and you having sex on a regular time, you will know your exact time of ejaculation from there. Because if you are not having sex for almost a month, and you had a fiancé or somebody to interact with, your ejaculation time will be short because you are not having sex for a long time.
Good morning, your name and where are you calling from?
I'm already calling from the SKD Boulevard.
Yeah, Mommy, welcome to Health Talk.
Thank you so much. I want to ask a question. What makes some people forget me and any solution that we please help me solve it?
Come again, we are talking on male health, male reproductive health, specifically on erectile dysfunction and that of infertility. Thank you.
Yeah, so that does it about the premature ejaculation or ejaculating soon, as you said. And the other concern about, what did he say?
The other concern, he said he want to know why some children can be 20 years and they still urinate on bed.
Oh, okay, yes. Many of the times, people attribute it to a sickness. Sometimes they go to the hospital, they say, oh, the child big and they're urinating in bed and they're looking for medication for that. I would advise that it's not advisable to look for medication for that. And it happens in human beings, most especially male, when they reach the age of maturity and they start having children, it can stop. And statistics have not come out exactly to tell what causes that. But over the time, maturity stops such a condition in male.
Okay. So the last caller was like, what made human be quick to forget? This is just a natural phenomenon, right? You don't expect life to be like static. Life is always dynamic. And once you are a living being, you're drinking water, you're eating food, you must forget. So that's just a natural phenomenon, the oneness of God. So I don't think, even when you have health-related issue, but actually that's not the topic for today. We are talking erectile dysfunctions and that of male infertility. So thank you so much for calling. If you want to be part of the discussions, the phone line is open. Call us on 0770-107-107, 0886-107-107. So call and be part of the discussion or ask all of your questions you want to know about male reproductive health. Let us move forward. Who is likely to suffer this erectile dysfunction?
Male suffer from erectile dysfunction.
Like are there any age range?
The age, yeah, there are age range. Except for any medical condition or underlying condition, it should be adults.
Okay.
It should be older people aged above 45 should suffer from sexual dysfunction and should seek treatment. But
hello, your name and where are you calling from?
Okay, good morning.
Good morning, your name and where are you calling from?
Yeah, my name is Peter Kukwe, calling from Chicago.
Peter, welcome to Health Talk.
Yeah, I would like to ask you a question. If I'm a partner, I think if I go as another person, I can still. How can I do that?
Come again, please give your question back.
I think my question is that if I'm a partner, if I have to tell my partner, I cannot soon. But if I go on the kid with the out there, I don't cannot soon.
Okay.
Yeah.
Okay, thank you so much. We'll address that. Keep listening to Health Talk.
yeah,
So her questions was like, if he having sex with his partner, he calm down very soon. But if he having sex with another person, like he found difficulty in coming down.
Yes. That is what I was just saying. If you have a partner, you should have your regular time with your partner so that the both of you will enjoy the long term. Because obviously, first impression, first sex, obviously is not long in every man because the anxiety will be high at that time. So if you have sex with your partner from the initial stage with high anxiety,
so
and you left from there.
What are you trying to say? So you can have sex like 2 or 3 times a day?
It depends on how
if you got the strength.
Yeah, if you had the strength and go that and more than that.
Okay.
And
what did people say? I think first round, second round, or third round, something like that.
Yes, first, second, and third rounds.
Wow.
Yes, some men do that, and some
we
men
gotta go.
welcome that.
Hello, Yadimi. Where are you calling from?
Hello, good morning.
Good morning. Welcome to Health Talk.
Actually, I'm Adrian.
Yeah, Adrian. Welcome to Health Talk.
Yeah, I love the conversation of the program, and for me, I don't know what's the problem. I don't come down soon, so I don't know. I just want to know, and I want to ask the doctor what's really the problem.
All right, thank you so much. Keep listening. We're just that.
All right.
All right. Thank you. There are some.
We got a call. Good morning, Yanime. Where are you calling from?
Yes, good morning.
Yanime, where are you calling from?
My name is Poema William, and I do join from the
Poema William, welcome to Health Talk.
Yes. Let me ask my question.
Mm-hmm.
Okay, like, so therefore, 8 rounds. If I go like the default to 6 rounds, what will be the effect on me or on that person who's going for that amount of time? Like 3 rounds, 4 rounds, 5 rounds, 10 rounds, 10. What will be that effect?
All right, thank you so much. Thank you for calling.
All
So,
right.
the first caller, you want to address the first caller?
Yeah.
Yeah.
The first caller talking about prolonged ejaculation. Prolonged ejaculation is not bad, but if you go longer and you are tired and you want to ejaculate, it becomes uncomfortable. And what happens is sex is a pleasure. If you go longer and you're not ejaculating, excuse me, you come up and relax. If you are, because sex has, you have to concentrate.
Yeah, because like when you having sex with your partner, it's not like two animal fighting.
No.
They got it something we learn in school. They say the foreplay, right?
Yeah.
It should come from the mind first. Then you should, romance your wife. Don't just grab the woman and then like having sex. Because everything, the concentration is on the mind, the brain, right? You gotta have feelings, you have to play with your wife, take your own time. Don't just, when you just grab the woman and then you want to have sex, the mind is not considered. I think you're going to take a little bit time to calm down, but you really like, you hold your wife, you play with her, you guys romance each other very good. Like, after some, that feeling.
Yeah, you have to establish orgasm between both partners.
Because the brain got to signal to that of the organs that are responsible to say, oh, yes, this one need to be in place, this one need to be in place. I think this is the time for this to happen, right?
Yeah.
So the other caller says sometimes we say sometimes some people can say they're going for first round, second round, third round, fourth round. So what would be the effect of men?
One of the effects a hard on men is after a long period of erection, you will feel pain under the umbilical. You suffer from severe pain from there because of prolonged erection, and it also has effect on your partner. If, for example, she has ejaculated, and then you continue to force that, she will also have some discomfort and feel pain. So obviously for men, you have pain. You suffer from pain under the umbilical
So
cord.
are there any medication for that, for erectile dysfunction?
Yes, there are medications. There are a lot of medications for that, and other diet. You improve your diet, improve exercise, improve activities, and avoid risk factors.
Okay. And what are some of the risk factors?
Good. The risk factors comprises of most especially lifestyle, alcohol consumption, or smoking. Those are things.
Especially the tobacco.
Tobacco, especially tobacco, it has serious effect on your erectile issue. So you got to avoid these things,
Okay.
and you will have an adequate or functional activities.
And certain drugs also, they illicit drugs.
Yeah, illicit
right?
drugs. Illicit
Yes.
drugs also does that, and even other medication prescribed by doctor, for example, those steroid drugs, hypertensive drugs, people those that have pressure, medical conditions like diabetes.
Yeah.
They are conditions
Like in
that
my
also
introduction, yes, I mentioned diabetes.
they contribute to sexual or erectile dysfunction.
Okay. And also having history of undescended testicle, so that can also lead to infertility or erectile dysfunction. Yeah.
Yeah.
So these are some of the risk factors. So mainly you have to take care of yourself. They're drinking too much of alcohol, like smoking, especially the tobacco. It's very dangerous for men, right? Taking certain medication or ongoing medical treatment, such as surgery or radiation use, or treating cancer. because in my introduction I also mentioned cancer. So these are some of the risk factors for infertility, right? So is there any awareness, especially in our setting, do men really know about this condition?
No, there is no awareness, except for those who have this condition and seek medical advice are the ones that are mostly told. But there is no public awareness on this thing, except for malaria.
So
HIV.
what is your advice to these people that suffer from erectile dysfunction or that of infertility?
My advice to men in general in the public now is you don't have to wait until you meet the condition. Seek medical advice to know exactly what you stand for or what happens to your body. Make sure you have your healthy medical checkup and know exactly your medical status in every aspect of your male activities.
So
or
can
your
it
male
be
health.
prevented?
It can be prevented if you do take into consideration or avoid the risk factors.
Okay.
Do
Yeah.
not smoke
Do not smoke.
tobacco, do not drink, don't consume more alcohol,
Yeah.
and treat a
Reduce
medical condition.
stress.
Yeah, reduce stress,
Eating
depression,
a healthy weight.
emotional stress can also contribute to that. Obesity,
Yeah.
meet or your take exercise, have your be healthy in general. Be healthy.
Okay, time is fast spent. Time is our greatest enemy in studio. When we discussing health, 1 hour is not actually sufficient. But do stay with us. We'll be back next week. So thank you so much, Mr. Zopon. Thank you for coming. Thank you for enlightening us on today's edition of Health Talk. We want to take this time to thank the Hot FM family for enlightening us time and thanking our honorable DJ Blue for giving us time in studio to always educate our people on their health. So thank you so much. Do join us next week, same time, same studio. I am Momoa Elumen.
Thank you.